There's probably some room for improvement in this bill, but I know that Senator Reid and all of the senators standing here with me today are committed, as we are, to making sure people can afford the care they need. And believe me, I will continue to be here on the Hill to make sure that each one of the senators do the right thing. Thank you.
Thank you, Loretta. Very nice. Very nice.
Thank you, Loretta Johnson. I am partial to ladies named Loretta. Let me just say at the outset that Harry Reid had to fight great political forces and the Senate rules to bring us to this moment, and the fight continues. We are proud of his leadership, and we thank Senators Dodd and Harkin and Baucus and all the members of the committee that helped to bring us to this moment. Last night I issued a challenge to the Republican side. We posted our health care reform on the internet for everyone to read, for the whole world to read every provision, every word, and to understand our goals. I challenged Mitch McConnell and the Senate Republicans to produce a health care bill that will save us $127 billion in the deficit over the next 10 years, and there's nothing posted on the internet. I challenged Mitch McConnell to come up with a bill that makes sure that 94% of Americans have the peace of mind of health insurance coverage, but the Republicans put nothing on the internet. I asked him to come up with a bill that would give us sound financial footing for Medicare, reducing the increase in health care costs, giving seniors a helping hand when it comes to Medicare prescription drugs, providing the basic wellness and exams that they need to stay healthy, but not one word from the Republican side of the aisle. The list goes on. I've yet to hear the first Republican senator even stand up and take on the insurance companies. That might tell you something. The fact is that we understand that the American people need a fighting chance when it comes to these insurance companies. You know what happens. When you need that insurance the most, they turn you down. Pre-existing condition, caps on coverage. No, that your son's 24 years old. We're not going to cover him now. We address every single one of those in terms of fairness and equity. So I listened this morning as Republicans came to the floor. I thought, well, what will they have to say? The leading criticism about this bill is that it's 2,000 pages long. 2,000 pages long, as if we don't have big bills before the Senate and the House. We do all the time. And this one addresses major issues, 1/6 of our economy, and also takes on the health insurance companies. You better make sure you have a lot of pages there to cover the lawsuits they're going to file to try to stop us. And I might remind the Republican side of the aisle, when it comes to the size of legislation, it was that bank bailout bill that the last president proposed that was only 3 pages long. Now, there's a work of wisdom. So, I would just say, went home last night, and Chris Dodd had made reference to Ted Kennedy during the course of our great caucus when we came together, and I picked up that book, True Compass, and started reading again about Ted's battles, going back for years on health care. I, too, wish he were here. I try to imagine what it'd be like. I try to imagine what it was like to be at a gathering like this when Franklin Roosevelt finally passed Social Security, when Lyndon Johnson passed Medicare. What a momentous, historic day that literally changed the lives of millions. Well, we've come on a long journey here, but we've come so far we are not turning back. We are not turning our back on the people who are counting on us to get this bill through. The millions of Americans who know that we have to finish this job and finish it right so there is quality, accessible, affordable health care for every single American. Loretta, your situation is a situation repeated across the state of Illinois and your state of Virginia and every state in this nation. It is time for us to stand together and pass health care reform.
Thank you. I want to thank all of my colleagues here today. I do want to mention, as the member of the Finance Committee who was here, Senator Max Baucus. He worked so long and so hard, and it's unfortunate he couldn't be here with us today in person, but he's with us in spirit, and he'll be back in person, and I am sure he will be behind the President as the President signs national health care into law, and he'll deserve a heck of a lot of credit for that. Senator Baucus, thanks for the great job you did. Of course, Senators Dodd and Harkin, that great team on the Help Committee, and the impresario, the great chef, Reid. I have this tie on here. It has eggs and cheese and pork. So it's a great omelet. Harry made a great omelet. You sometimes have to break a few eggs to make a great omelet, but he did. He's a great chef. Cheese came. We had very good cheese from the Finance Committee and pork from the Help Committee, Tom. I couldn't say pork from the Finance Committee or I'd be in trouble. But in any case, this is really a good bill, a really good bill, an outstanding bill. Who would have ever thought we could cover 94% of the people, save Medicare and private insurance, which were going broke, eliminate waste, fraud, and duplication, and at the same time cut more costs, unnecessary costs, from the federal budget, $503 billion, than any bill has ever done, and reduce the deficit by $127 billion. It's an incredible work. And the momentum has now shifted to us. All the naysayers, those 2,000 pages, each one will represent hundreds of people who get coverage, hundreds of people who will keep Medicare, hundreds of people who will keep their private insurance. Those pages push the momentum in our direction because people see what the bill does. All the fears and all the negativity are sort of blown away by those words. And it is humbling to be here. We're not there yet, but we are in the territory that's very close to getting over the goal line. We are in the Republican territory now, and we're marching forward. And so I just want to say that this has been long overdue, and it's what we've been able to do so far and will continue to do until the President signs that bill into law. This is what we should be doing here. This is why we're senators. This is why we're legislators, to help our constituency despite all the obstacles thrown in our path. We will succeed. There will be a bill signed into law that America and all of you can be proud of.
It has been a long journey, one that is not over yet, but I am so excited to stand here today as we move closer than ever to passing an historic bill that will finally reform our broken healthcare system and help millions of our families and small businesses get the coverage they need at a price they can afford. It is about time.